Today I'd like to talk to you about the techniques involved in rhinoplasty surgery. Rhinoplasty is the recontouring of the nose, and there are a couple of different ways that can happen, and part of it depends on what you need changed. Now, there's either an open technique or a closed technique. The closed technique has no external incisions that you would see, but that's performed kind of in a blind fashion because we can't look in and see the areas that we're working on. It is useful if there's just a slight dorsal hump or a little irregularity here and there. It's a good option to try that and to utilize. But more often when there's a number of different issues about the nose or a more complex repair has to be done, an open technique is utilized. And that's one where we make a little incision across the columella, that up and down portion of the nose. That's the only external part of the incision. The rest is on the inside of the nostril on each side. And then we lift up the skin and the tissue, and we see the bones and the cartilage underneath. Now, the structure of the nose is made up by those bones and cartilage, and that's what creates the shape of the nose. So we make our changes on that cartilage and on that bone, and then redrape the skin, and we see the new contour. The skin kind of adapts to that. A lot of times we have to take away some of the bone and some of the cartilage, and sometimes we even need to break the nose in order to make that whole pyramid of the nose smaller and make sure it's not flat across the top. We want it to have a nice kind of a triangular appearance to it. We make those changes on the cartilages and the bone, and a lot of times on the cartilages, besides just cutting them, we'll put some stitches between them to put them in a different orientation or a slightly different angle so that it creates a more harmonic vision of what the nose is going to look like. We redrape that skin, and then nature does the rest with healing.